Well, it's time for our health report, and joining us now is Africa 54 Health correspondent Linord Moudou with details on a major African immunization push. Hello, Linord.
That's right, Vincent. During this week's African Union Summit in Addis Ababa, Ethiopia, heads of states from across Africa endorsed the Addis Declaration on Immunization, also known as the Ministerial Declaration on Universal Access to Immunization. Observers say while Africa has made impressive gains over the last 15 years toward increasing access to immunization, progress has stagnated and the continent is falling behind on meeting global immunization targets. 1 in 5 children in Africa still does not receive basic life-saving vaccines, and as a result, vaccine-preventable diseases continue to claim many lives. The Addis Declaration on Immunization includes 10 commitments, including increasing vaccine-related funding, strengthening supply chains and delivery systems, and making universal access to vaccines a cornerstone of health and development efforts. Now, the United Nations World Food Programme is extremely concerned about the critical food insecurity situation in northeastern Nigeria.
The World Food Programme says 4.7 million people are facing hunger in Boko Haram-affected areas, Borno, Yobe, and Adamawa states, and 1.8 million of them are in need of emergency food assistance. The residents there are desperate.
Boko Haram killed people, more than 3,000 people, more than 1,000 houses burned. Already distressed. Our market is distressed. We will not get market. We will not get eat food.
People living in newly liberated areas are suffering from extreme hunger and malnutrition. Children in particular are suffering from severe acute malnutrition. Linord Moudou, a 35-year-old mother, fled her village with her husband and 5 children when Boko Haram attacked.
Me and my children, we need food. The biggest problem we have is hunger.
Moudou and her family are dependent on food aid to survive. Her children are eating a highly nutritious peanut-based supplement provided by the WFP. In November, the WFP launched a joint rapid response mechanism with support from UNICEF to supply food, nutrition, and health support to people in difficult-to-reach areas in Borno and Yobe states. The deployment of the rapid response team includes extensive use of helicopters and the pooling of logistics and telecommunications resources across the humanitarian community. Ertharin Kazan is executive director of the World Food Programme.
What we need is the international community not to turn away from Northeast Nigeria. There's a lot going on in the world, and so it's easy to say that's just one more challenge with another group of people who are suffering from insurgents, and it's not my problem. If there is a child, a mother, who cannot feed a child, and a child who is going hungry, that's our problem.
The rapid response is part of the World Food Programme's larger operational plan to gradually ramp up to reach 1.8 million people a month with nutritional support in 2017.